A client has just been hospitalized due to a pneumonia, and since she is suspected of potentially carrying a multi-resistant bacteria, she has been placed in an isolation room. The nurse needs to take the client's temperature, and the latter is wondering why she has been placed in isolation. Depending on the type of isolation, the nurse needs to select and put on the right personal protection equipment. In this given situation, disposable gloves and a mask are mandatory. Hand washing with an alcohol-based solution removes bacteria on the surface of hands and eliminates the propagation of pathogenic agents. Hand washing before putting on the personal protection equipment is an integral part of the 4 moments when hand hygiene is required. For the purposes of this tutorial, hand washing is compulsory before coming into contact with the client at any given time. The nurse conducts a visual inspection of the gown to make sure there are no defects. While doing so, the gown must never come into contact with the floor to avoid contamination. The gown must cover the whole of the nurse's clothing. It also needs to be replaced by a new one between each patient as soon as it has been soiled by body fluids, if it is not waterproof, in order to prevent pathogenic agents from seeping through the gown and contaminating the nurse's uniform as well. Tying the neck and waist laces prevents the gown from accidentally opening during interventions with patients. Nurses with long hair must keep it tied back at all times. To put the mask on, the nurse places the adjustable nose clip over the nose and molds the clip to fit the nose bridge. The mask protects the nurse's face against splashes and projected droplets. It also protects the client against the nurse's secretions. Equally important, the mask must cover the nurse's nose and mouth. The latter must also keep in mind that the mask must be replaced by a new one at every 2 hours or when it is moistened, and must never be repositioned during the care procedure. To end, the nurse puts on disposable gloves, all the while making sure the cuffs of the gloves are extended over the gown cuffs to reduce the risk of contamination. He examines the integrity of the gloves. If they are torn or punctured, he must replace them with new ones immediately. Torn or punctured gloves can lead to contamination through the skin of the nurse's hands.
Hi, good afternoon. My name is Philip, and I will be your nurse today. Your temperature was a bit high this morning, so I'm going to go ahead and see how we're doing on that end. How are you doing today?
Very well.
Okay, what was your name?
Julia Smith.
Okay.
I feel a little bit lonely, you know? I do not get a lot of visitors, and I was wondering if I could go in the hallway just to take a small walk, around.
Now, I understand it can get quite lonely in an isolation room. However, since you were hospitalized 6 months ago, we need to verify that you haven't contracted a multi-resistant bacteria. So as soon as your results come back negative, then we'll be able to let you go out of the room as much as you like.
Okay, thank you. I understand better now.
Clients having been hospitalized over the past 3 years are considered potential carriers and put in isolation. MRSA and VRE samples are thus taken. If the results are negative, the patient can be taken out of the isolation room.
So I'm going to go ahead and take your oral temperature. I'm going to ask you to open your mouth. And I'm going to put this under your tongue. If you just close your mouth, and let's see what pops up here. Yeah, perfect. So 36.8. So the good news is your temperature has gone down.
Okay, that's great.
It's good to stay positive like that. So I'm going to go write that down in your file. I'll be back in 1 hour. In the meantime, if you need anything, feel free to push on the help button and someone will come and see you.
Okay, thank you.
Okay.
Informing the client about the time the nurse will come back and that she can ring at any moment for assistance will help her feel better and less lonely. The nurse must follow a specific personal protection equipment removal sequence in order to avoid contaminating himself. To take off the first glove, the nurse grasps the exterior edge and peels it down to turn it inside out. He then rolls it up into a ball in the gloved hand and keeps it there. After, he slides 2 fingers of the ungloved hand under the cuff of the second glove without touching the exterior surface. He stretches it and turns the glove inside out and over the first glove. He discards the gloves in the designated receptacle. After, he washes his hands with an alcohol-based solution before continuing the removal procedure. The nurse then unties the laces at the neck and waist of the gown. He grasps the neck laces and pulls them downward toward the elbows to free the shoulders. He then grasps the inside of the sleeves at forearm level and pulls the gown away from the body. He then pulls it off completely and rolls it into a bundle without ever touching the outside of the gown. Touching the inside of the gown only keeps the nurse from coming into contact with the contaminated surface of the gown. The gown must then be placed in a bag reserved strictly for soiled laundry. If the gown is of disposable type, it will simply be discarded into a trash can. To avoid contamination, the nurse must never touch his own clothing throughout the entire process. After, the nurse proceeds to washing his hands once again with an alcohol-based solution before removing his mask to prevent any type of associated contamination. The nurse grasps both elastic loops behind his ears and removes the mask by pulling it away from his face. After, he shall proceed to hand washing one last time with an alcohol-based solution. In the case of an isolation due to more contagious and resistant bacteria, for example, Clostridium difficile, it is mandatory to proceed to hand washing with soap and water at the end of the procedure to mechanically eliminate the pathogenic agents.